Thank you for joining us today. Today we're talking with Neuraura, a biotech company based in Calgary, Canada, that's transforming the standard of care for chronic, underserved health conditions. Currently, they're working specifically on advancing technology to help those suffering with PCOS. PCOS, or polycystic ovary syndrome, can cause hormonal imbalances, irregular periods, excess androgen levels, and cysts in the ovaries. Irregular periods, usually with a lack of ovulation, can make it difficult to become pregnant, meaning PCOS is leading cause of infertility. It's estimated that 8 to 13% of reproductive age women suffer with PCOS, and up to 70% of affected women remain undiagnosed worldwide. So today we're lucky to be joined by Neura's CEO, Claire Dixon. Claire, thank you so much for joining us today. I just wonder if you could start us off by telling us a little bit about yourself and how you developed your business, because we'd love to discuss your journey and the ethos of Neura and your device as well.
Awesome. Thanks, Sarah. Yeah, I'm thrilled to be here. A little bit about me. I am based in Canada. I've been here about 14 years, but I'm originally from the UK. So your listeners will probably pick up a bit of an accent. For me, entrepreneurship is the third career. First career in consulting, and then second career in kind of senior operational roles in academia. And really, when I started working with people in entrepreneurship, I was like, I found my people. Just kind of the drive and a mission bigger than themselves. So it's just, love working in this field, obviously with my team as well as the broader entrepreneurship community. In terms of kind of my what I bring to the role and kind of my special sauce, I'd say. I've always loved working in kind of complex technical areas and, have really loved transitioning that into the healthcare environment, particularly with a condition as complex as PCOS. I think kind of one of the reasons that we are where we are in terms of the standard of care today is just purely its complexity. It's a multi-system disorder that affects how you metabolize, how, as you say, your hormonal cycle, and really affects your well-being in lots of different ways, and even how your cells replicate and repair. So, has increased risks for certain types of cancers because of that. In terms of the business, so Neuraura has been around for 7 years, but we've only made this pivot into the women's health application about 18 months ago. That's been a tremendous decision for us and absolutely incredible over the last 18 months, kind of getting our product ready to get to market. Our core technology is a microelectrode, so a neural electrode, so it can both record brain signals, but also can stimulate electrically. And so we're applying that non-invasively in this indication. So it has application for lots of different clinical problems, but we decided to choose PCOS, really looking at the scale of the problem and the current state of play in terms of what's there for people. So standard of care, as you probably know, is hormonal contraceptives, which, if anything, they actually make the condition worse in some ways. So, they can lead to additional weight gain. They obviously disrupt fertility. I mean, that's their job. That's what they're designed for. And there's additional side effects that come with the pill. And so it really just pushes the problem down the road for later. And so, we're really excited to be able to innovate in this space. We found some amazing research led by a true thought leader in the field of PCOS, Dr. Stena Victorin. She's Chief Scientific Officer of the Global Research Association, the PCOS Society. And so we're translating her research into a device that women can use at home. And our goal is to make that widely accessible to as many people as possible. As we came along this journey over the last 18 months, we've really learned so much about the burden of this disease, and frankly, the current system of care adds to the burden of the disease in many ways. For example, a lot of women with PCOS develop eating disorders because the only option that's presented to them is go away and lose some weight, which is incredibly difficult if you have PCOS or metabolic PCOS. So, part of our broader mission is actually to lessen that burden. And so we're building a digital platform which aims to bring everything together into one place. So great answers, right? Take all the scientific evidence as it stands and make that accessible to people, but also complementary clinical and wellness solutions for this user group. Yeah, so
That's
that's what
amazing.
we're about.
I mean, it's great to hear of kind of information being made more accessible to people as well, because I think a lot of women and a lot of people experience it can be quite frustrating going to doctors and kind of going back and forth, getting different suggestions about what might be happening, and then eventually maybe getting a diagnosis, and then, like you said, not being given the most helpful advice. And it can be quite a disheartening experience, especially because obviously a lot of medical research wasn't necessarily based on women's own health conditions. So a lot of it can fluctuate. And Lena, I know you've had like a very long experience with your own health, and I wonder what your kind of perspective on this kind of topic is as well.
Yeah, I mean, it's interesting what you say, Claire, about it affecting like mental health, and how also being told to take contraception as a treatment method, which can actually make things worse, make you gain weight. For me, and if you've listened to previous episodes of podcasts, you'll know from very early on, I have had problems with my menstrual cycle, heavy periods, irregular periods. It was unfortunately not until sort of my mid-20s, early mid-20s, I think it was about 7 years ago, that I was diagnosed with polycystic ovaries. And that was after years of me complaining to my doctor about, and because I was thin and I didn't have excessive hair growth, and I didn't have all of the traditional kind of polycystic ovary symptoms. I think it took such a long time for them to really be taking me seriously. And when I did get my diagnosis, it was, okay, so you're on this pill, we recommend a different pill, or the coil. And for me, like I especially in my early 20s, really struggled with mental health. And the thought of going on more hormones was just like not an option. And I can't remember, I mean, this was years ago, so I can't remember exactly the journey that I went down. And I'm pretty sure I went down the route of having a coil fitted, which had other complications, and then trying all sorts. And then 6 years after that, I then got diagnosed with endometriosis. I think, that the awareness is growing, and like the support is growing. And I'm so glad that we're even having this conversation and talking about this like such an important topic, because I remember 7 years ago when I was told I had polycystic ovaries, you just kind of Google it, and then you find all these things about infertility, and it's a scary space. So I think from me, and hearing different people's journeys as well, because where they're so different, like the symptoms and the like the concerns that you have, and that they're all so different, but can be from the same cause, could be exactly the same condition, but two different ends of the scale on what your symptoms are. And I think like that makes it really difficult, relatable and unrelatable, and quite confusing. But for me, personally, so when I had my diagnosis, like luckily at that time, like kids weren't really on the cards. I wasn't really thinking too much about fertility. I wasn't under a lot of pressure, I suppose, to conceive. But I can imagine that, if you are a woman who's just been diagnosed and you're desperate to have kids, that would be a really sort of, scary situation to be in, because one of, like, as you mentioned, those stats earlier, Sarah, that it is a huge cause for infertility. And and I'm very lucky personally to have been able to conceive naturally. And, but I know a lot of women struggle with that. So I feel incredibly lucky actually to have these two huge conditions which have affected me physically and mentally for years. I just feel really lucky, like genuinely so lucky, because I know some women are like getting their eggs frozen at 20 years old because they've just been diagnosed, and or having to go through chemical menopause at 30 years old. They're not quite ready to have kids, but they're in so much pain with and they've got such large cysts on their ovaries. This is what they've been recommended. So, which comes with its whole other world of symptoms and everything. So, yeah, it's something that I'm really passionate about, but I also feel really, I guess, lucky in a sense that I've managed to go through that. Yes, it's something I've had to live with, but it hasn't luckily affected me, my journey, my life too much. But I really do empathise with those that has had a long fertility journey or long struggles and with the condition.
Yeah, for sure. Yeah, I mean, when we pivoted to this application, it was actually one of our interns that started to teach us about this condition and the effect it had. And I mean, if you can imagine, I'm sitting there in a business team meeting with one of our, young interns, and, I went through 8 years of fertility treatment. And 4 different doctors, the whole shebang, right? And the end of the story is lucky. I have a lovely 9-year-old son. I wish I had more, but that wasn't on the cards for me. But in 8 years, nobody mentioned PCOS to me at all. And when I later talked to my kind of GP about it, who's great, by the way, like a really good doctor to me, we've had a good relationship for years, she was like, well, you don't have a BMI of over 35 and you don't have a beard. And I was like, having done my research on PCOS, I was like, but I have high cortisol, I have high cholesterol, I have ADHD, I had postpartum depression. Like there's not just one way in which this disorder manifests. Mm-hmm. And maybe it's not just one disorder, right? There's at least 4 clusters of different ways in which it's manifests typically in folks. But it's not really the GP's fault, because at least here we found that they get less than an hour of training in unless they specialize in this area. And actually PCOS isn't owned by any clinical discipline, right? You've got endocrinology, dermatology, obs and gynae. They kind of all see women, obviously, as almost 20% of the population have this, present in different ways, but nobody owns it because it is so complex and affects so many different systems in the body. So the system just isn't geared up to really support women on this journey. And so it's not surprising, right? Like, and I think the commonality, I hear so many stories about different experiences, different primary versus secondary concerns, things, people who have polycystic ovaries who have periods like clockwork, right? Who don't have irregular periods, don't have any problem conceiving, but they have cysts. It's that burden, right? And that's why I feel like there's so much opportunity just to chip away at that, right? Because when you sit down with your doctor, you've got an 8-minute appointment. You're only allowed to talk about one symptom at a time, right? Which doesn't lend itself well to this type of complex condition or endometriosis or any other of kind of these chronic conditions we unfortunately are dealing with. We really are going to strive to provide a place where, at least to the extent that the research exists, we'll make it available in one place. And that's kind of, our starting point as we work towards getting our device, obviously a therapeutic device, onto the market. Because the commonality is there's been that emotional toll, the stress, the anxiety, the depression, as a result of having to deal with this.
Absolutely. I mean, I think that's it's really nice to hear that it was an intern's kind of suggestion or bringing it up, because it is something that I think in the last like 10 or so years, there's been a more recognition on these kind of chronic women's health conditions, whereas it's not like they didn't exist before or haven't always existed. So it's great to see that people are kind of like taking it to themselves, and where the resources are lacking in one place, making it their mission to make it more accessible and to kind of have it more spoken about, because just you're saying like the more people go to doctors or more they bring attention to it, the more research is going to be able to be added to it, and the more that can be done to actually provide supports, because it is something where unfortunately there is no cure for it, as a lot of chronic health conditions, like same with endometriosis, it's kind of a part of that female experience to just continue experiencing pain and discomfort because it's built in. So I think it's so important to have kind of companies now really working to lessen that and to change that, because there's no way that we can kind of continue on the path we're going on without putting a spotlight on women's health. So I think it's great to see that that's something that you guys are really like taking considerate care to do. And it's something that we as well are really trying to pivot that way into women's health, specifically towards like menopause, and kind of just making overall like hormonal and health testing more accessible, and trying to provide an at-home service for people. And it's still in its kind of early stages, but it's something that like can be very daunting as well, going to a doctor, or very time consuming, and not everyone has the time to afford to do it. So I think that was kind of our impetus behind it as well. I don't know if you agree with that, Lina, but just like that, making it something that people can do themselves without having to struggle to be heard, and maybe being able to go to a doctor and show them what their kind of at home report says. I don't know if you have anything else you want to add on the health checks as well about the kind of menopause side, because I think that kind of is another thing where not every person's menopause experience is going to look the same way. And that's something that we've learned a lot in our kind of discovery of it as well.
I think our mission is to make information more accessible, and in some way, like Claire, you mentioned, I don't know how much training our NHS doctors have over here for these types of conditions, but I would assume, minimal. And I do think it's really important that we advocate for ourselves and we educate ourselves. And actually, I think the most productive conversations that I've had with GPs have actually been after I've said, this is all the evidence that I've gathered, this is my research, this is what I think is wrong with me. And then actually things have progressed, and I've managed to get somewhere, like get a scan or a blood test. And I think that's what we're trying to do at DocHQ, is to make that more accessible, and give, with our health checks, is to, give people the power to be able to gain that information themselves rather than relying on long waiting lists. I mean, I had a text the other day from my GP asking me to book a blood test to review some medication, and I can't get the appointment for another 4 weeks. So kind of, which is fine, but it's the NHS, but if I could get that done privately, then, and it was urgent, then I absolutely would. So I would definitely, urge people to try and take control if they can. GPs are great, obviously, and absolutely appreciate that NHS is under a lot of demand right now, but just try and do what you can. It will definitely help. And just doing your research, whatever your condition might be, whatever your age might be, whatever your symptom might be, I would just, suggest those people do their research and advocate for themselves. But one thing that I wanted
I mean,
to oh, go on, Claire.
no, go ahead.
I was just going to say, I wanted to ask sort of like your guys' opinion on what, should be expected from employers. Obviously, I've been through this. I've, been very open with my managers and everything. But what can employers do to support their staff who are going through these, challenges and who've either been diagnosed or waiting a diagnosis?
Yeah, I think it's a huge piece of the puzzle. I'll just close my door a sec. I was just gonna add that I don't see a conflict between what we're doing, what you're doing, and actually lessening the burden on the health system, because it's these chronic conditions. And when we look at women with PCOS, women with endometriosis, the burden of disease kind of escalates through life, right? So with PCOS, it's the development of diabetes, cardiovascular disease, and dementia, right? Where it's type 3 diabetes. That's like the highest burden on the health system. And so, I think the trend towards thinking, longevity and actually improving those health outcomes and delaying the onset of some of those chronic complications of some of these disorders is exactly where we're at, right? Like, let's give people the best lives you can give them for as long as possible, right? And push off some of those complications as long as possible. So I think that empowerment piece is entirely consistent with a system like the NHS, and kind of the shared responsibility for your health, which I think, you have to be an advocate, you have to be at the table, because you can't just assume, right? You have to do your own research to be a good consumer of healthcare. In terms of the work question and how do we support people at work, well, I think there's a shift happening, right? And which is really exciting around attitudes towards work. And I think if there were a small number of positive things that came out of the pandemic, it's probably one of them, in terms of recognizing that our post-industrial revolution, treating people like machines, you're going to get the best out of people if you put their bum in a seat for 8 hours a day, 5 days a week, is not necessarily how human beings operate. I think it's really exciting, actually, in the same way that companies like Wild AI are looking at kind of athletic performance, in terms of how across your hormonal cycle you can actually perform better at different times of the month. I think it's really exciting. Companies like I talked to Phase App earlier this week, how you can actually think about how you're going to perform at different times, like in the luteal phase of your cycle versus other phases, and actually start to shape your, to the extent you have control, what activities you're doing at work, what you're focused on, so that you will perform to your absolute best. I think that's really exciting from an individual viewpoint. I know when I give a pitch, when I'm ovulating, I'm on fire. So, watch out, right? But I think employers, I'll say this, same thing for doctors. It's like, start with just listening, right? Listening and making people feel seen and heard in every realm, workplace, at home. If you're a partner or a family member supporting somebody with a chronic complex condition, just making people feel heard and seen is like sometimes the biggest thing. And I think we're starting to break through some of those barriers around perhaps kind of some mental models, right, which are outdated and we need to kind of let go of. So things like, to be a woman is to suffer, right? Like, I think kind of the attitude towards women's pain, right, whether it's just regular cramps once a month, right, to any, the horrendous burden of endometriosis, say, I think we are changing our attitudes to that in terms of like, no, it's not normal, it's not okay, and it's not something to be ashamed of, to be forced to keep quiet about. It deserves the same respect and the same care as any other condition, the same as mental health conditions. And I also love what's happening in the menstrual health space, where there's just so much cool stuff happening, right, in terms of accessibility to break down kind of the horrendous period poverty, which affects so many women. And like, I think it's so great to see kind of workplaces really picking up on that, and changing the dialogue on that. It's nothing to be ashamed of, right? We deserve toilet roll, we deserve menstrual products. It's just the same, right? So I think attitudes are shifting, and I think awareness is also shifting in general, and the more we talk about these things openly, the better. And I think, obviously, I'm Gen X, right? Like, I see such a change in younger people and their expectations and what they're demanding of the workplace, and I think that's awesome.
Yeah, absolutely. I mean, it's definitely an open dialogue kind of is the only way forward. And like when you were talking about the pandemic there, it really did change everything about how people are approaching work, and even the fact that people can work remotely, whereas before it was a very rare thing, and how that's changed the lives of people that maybe have chronic health conditions, have children, have mobility issues, have mental health problems, like completely changing the landscape of the working world. And also, I think it's about there being a higher number of diversity in leadership roles now. A lot more women are taking on CEO positions. A lot more people are kind of asking their employees feedback, and it's less of a kind of divide now, which I think is a very exciting thing to see, because obviously we need it. Like there's no way to kind of go forward without that. Especially when there is a more open conversation on health, and specifically women's health. We had an amazing chat a few weeks ago with a kind of menstrual health coach, Lizzie Kurtzer, and it was exactly what you're saying, this kind of understanding of the phases you're in, and why you might be feeling like you aren't performing as well one week, and that kind of affecting you mentally. And really, it's this kind of internal map that our hormones are kind of showing us. So that kind of information, people have had periods forever, and it's only now we're kind of having that kind of conversation. So it's exciting to see what will happen next in terms of these kind of conversations on all health problems.
I learned this week that actually in like the luteal phase, that phase when you want to be at home in your PJs. Unfortunately, I work from home all the time, so I wear leggings all the time. So I'm very I'm very lucky. But in that luteal phase, like when maybe you feel a bit crummy, you've got some cramps, like you've got slightly lower energy, it's actually a really good time for decision making, because you're more able to have like flexible thinking styles and bring different lenses to decision making. Well, isn't that like such a huge asset in the workplace? Somebody who's like a little bit more adaptable in the decision making, right? For coming up with more creative solutions for stuff. So it's like, not seeing, there's pluses and minuses, I guess, of all the days in our cycle, and I think learning to embrace that. And I think for me, I didn't get formally diagnosed with having ADHD until I was in my 40s. And just, part of my journey with that was like, the concept of disability is contextual, right? So, things are only this negative thing that holds you back in a specific context that doesn't leverage and appreciate that. And I think, whether it's women going through the menopause and like struggling at work because, the expectations that are placed on them at that stage of their career just don't fit with kind of how they're feeling, or whether it's just like, this is a bad day for me to show up at the office because I really don't want to make it out of my pajamas today, right? Like, it's not all bad, right? There's always good and bad that comes with all of this. And it's around like, if you can make the right accommodations and put things in the right context, it actually can be a superpower, not a disability, right? So, and I'm talking very broadly about that as well.
Absolutely.
So yeah.
Yeah, I mean, I just on the kind of closing note, I think it's so exciting the kind of world of health tech, biotech we're kind of in now, and we were talking about earlier the underfunded like health services that all over the world, so it is exciting to see this kind of rise in new forms of healthcare and new research being done. I had seen recently that there's a company that's kind of focusing like they're doing stem cell testing and health testing with actually period blood, and they're getting people to like send samples, and that's just the kind of stuff that like the ingenuity that you think that people would have started doing this years ago. And it's exciting to see a company like yours as well kind of focusing on something that's a very difficult to manage type of chronic pain and condition, and kind of looking at it from a technological side. I think it's just really exciting to kind of see the prefaces of everything, what could be with all the science and technology.
Yeah, no, I love what Quinn and NextGen Jane are doing, and there's others as well. Like, it's kind of the canary in the coal mine, in terms of they can see biomarkers in menstrual blood you can't see in a blood draw, and so like it really kind of, it's something we've like been disgusted by, that has been stigmatized, that has been like to view that as like obviously like we live in a world where AI is the hottest thing ever, but the data source of having that like amazing like rich source of information, and seeing that for what it is, I think that's a huge step forward in terms of our attitude to women's bodies and what's a normal function, right?
No, it's amazing. Very exciting. Well, thank you so much. I think we're just at the time now, but thank you so much, Claire, for joining us. It was so interesting to talk to you and kind of have this kind of very open conversation on PCOS and women's health in general. And Lina, thank you as well for sharing your kind of experiences. And best of luck with everything, and hopefully see you when you're back from maternity leave. You'll be missed.
Thank you. No, thank you
Okay,
both. I
thank you,
really
ladies.
enjoyed that conversation. Thank you guys. Take care.
Yeah,
Bye
take care,
bye.
Lina.
Thank you.
Bye. Bye.